Hi, everyone. Good to see you again. So, we've been talking a lot about financing development from infrastructure, climate, growth. But one of the most powerful and sometimes overlooked investments is health. And so we're going to talk a little bit about how we can make the case for investing in health as an economic growth engine. And I'm really delighted to be joined by Brad Herbig, who's a senior fellow and director of health data and analytics at the McKinsey Health Institute. And you do a lot of research and get a lot of data, really looking at how investing in health can have economic returns. And I want to kind of dig in and learn a little bit about some of the insights from your research and a recent report that you have that came out about this. Just a few stats. Every $1 invested in health yields a 4x return, which is pretty amazing. Yet without action, NCDs could cost the global economy $36 trillion by the mid-century. So Brad, just really kind of talk about this. How do you see us being able to reframe the way we think about health from being a cost center to really an investment with measurable returns? And what is your data saying to paint that picture?
Yeah, absolutely. And thank you for having me here. I'd like to start with really the scope of the problem that we're addressing with NCDs and health more broadly. And if you think about non-communicable diseases cause 30 million deaths every year globally, and more than 750 million years lived in poor health each year. And this problem, this burden, is not only a terrible human cost, but it's also an economic cost. So one way that you can think about this disease burden is like an invisible debt on the balance sheet of every country. So this debt requires interest payments that show up in terms of reduced labor force participation, reduced productivity, and increased healthcare costs. But one way that you can think about health investment is really being able to pay down some of that principal on that invisible debt. So by investing in health, having a healthier population, that can then lead to economic growth through things like better productivity, et cetera. And so I think it's really crucial to think about health not only as a cost in which that we get a social benefit for, but also an economic one. And so in some of the research that we did, we looked at what would be the impact of scaling access to interventions, health interventions that we already know work and that we already know are cost effective globally. And what we found was that you could actually reduce deaths by 30 million every year. You could extend life expectancy by 5 years on average across the world, and healthy life expectancy by 7 years. And the result of all of that is the healthier workforce is able to add an additional $11 trillion to global GDP by 2050. And so to put this into context, that's like adding more than another Germany and Japan to the global economy. So this is a significant opportunity. And as you mentioned, the returns are great, a 4-to-1 return on these investments in health that not only have the social benefit, but also the economic one.
Yeah, and so how do you think about how we get policymakers and governments to really have this data show up in their policymaking? I think there's been, as we are facing a resource constraint environment, right? And a lot of countries have a lot of demands and needs they're trying to prioritize. How you make health be top of that list, and what are you hearing from different policymakers and governments that you work with about how they can take this data that shows the good case for this, but actually make that a reality in their national programs?
Yeah, absolutely. I think part of it is really building in the fact that health impacts labor into how they do their labor and growth modeling. So most countries around the world do not consider the impact that the health of a workforce has on their productivity or the likelihood of someone being able to work. And so what that means is when you look at growth planning or thinking about what it's going to take to actually achieve economic growth in a country, you're missing an entire lever of health that isn't showing up and isn't really showing the return in your models of what health is doing for the economy. And so I think that's one crucial place. I think the second one is really, I think one of the challenges and the benefits of investing in health is that there are both a lot of industries and sectors that influence health, and there are a lot that benefit from it. So if you think about an investment in health, the return for that may show up not in the health ministry, but it may show up instead in education or in labor or in social programs or things like that. And it is hard to then allocate towards, all right, how do you tie that back to the original investment in health? So I think one of the things that is important for actually moving to action on this is to think about the intra-ministerial kind of investment together in health, whether that's a prevention fund or other things like that, because one of the things that allows us to do is really to acknowledge that there are these connections, actually measure them, and that can help benefit the amount of capital we're able to deploy there. And so one example I like to give is there's a study on how investments in physical infrastructure actually give a higher return when you invest in health alongside of it, because that investment in health improves the human capital that is then able to use the infrastructure more effectively and result in a better return.
Yeah, I think a lot of the conversations past year, you see people not just wanting to talk to the health ministers, but also the finance ministers, the environment ministers, and helping to bridge all of that. And I'd love to hear kind of some of the new financing tools that you are looking at. There's like debt for health swaps and outcome-based financing. And what models are you seeing that can help kind of bridge that investment gap?
Yeah, absolutely. As you mentioned before, there's a lot more pressure on health budgets with increasing debt distress, other priorities that funding is being allocated to instead. And I think one of the important ways to think about this is how can we make the current money go further, and where we do need new money, how do we bring it in? And so the first promising mechanism I'd highlight, as you mentioned, was the outcome-based financing. So instead of paying for activity or paying for fee-for-service, you're paying for outcome instead. And so what that does is aligns the incentives across all of the stakeholders involved. And so if you are able to get someone healthier for less money, you benefit, and obviously the person benefits because they are now more healthy. And so that incentivizes things like investing in prevention, which have a longer time to return, but still then can bring those returns forward in terms of the benefit there. So I think this has seen some early success in many places, and I think one of the crucial things moving forward is really thinking about how do you simplify and standardize it a bit to help make it more scalable. The second mechanism that I'd highlight is the debt for health swaps. So if you think about, especially in many low and middle income countries that have significant debt distress, that can be a great mechanism to free up some of those funds that would have gone towards debt servicing to instead be able to invest in health infrastructure. And this is a great mechanism because it not only helps with a bit of the debt relief, but also funnels those towards the priorities of the countries that can help them to set up the health infrastructure that will enable their kind of long-term success and enable them to better mobilize domestic financing as well. And then the third one that got a lot of attention at the UN General Assembly high-level meeting around NCDs is actually health taxes. So these are taxes like tobacco taxes, alcohol or sugar-sweetened beverage taxes. And these are interesting for two reasons. One is they help reduce significant risks of non-communicable diseases, so tobacco use, alcohol use, et cetera. And so they have a direct health benefit in themselves. But the second benefit is that they also are a way to quickly raise revenue that can then be reinvested into health. And so you kind of get a win-win on that. And there have been many instances across the world where this has been successfully implemented cost effectively and is a really promising way in the short term to kind of open up capital there.
Kind of using both a carrot and a stick, I guess,
exactly.
in one. Yeah, so you talk about obviously the connections between investing in a healthy population and the economic benefits when it particularly comes to maximizing labor productivity. So how can you think that leaders can more explicitly make that connection between investing in health with their labor and growth strategies?
Yeah, so I think on that, part of it is what I was talking about before about actually building into the labor and planning models. I think that that's really the first step. I think the second piece that's crucial to actually having this happen is making sure that you get the data that's going to help you make and continue to make the case. So what that looks like is interoperable data, not only within the health sector, so having private hospital and public hospital data talk to each other and be interoperable, but also between health and finance and labor and other sectors that you can then more directly measure the return that you're getting in these other sectors, in addition to having the better health outcomes, which is, of course, the first purpose of this, but helps to then make the case and improve investment that way.
Yeah, and I want to talk about a little bit, digging into this data challenge and where some of the gaps are and where you see the opportunities in being able to more easily get this data accessible across the many different stakeholders that you need to bring in.
Yeah, the data challenge is pretty significant because especially with systems coming up kind of at different times and with different stakeholders, they don't immediately talk to each other. So there needs to be some coordination around how do you set the standards, how do you actually make those technical connections to be able to have the shared data and analytics platforms that allow you to actually get those done. The second is really around the analytics capabilities to actually be able to get the value from that data and understand how that influences both the setting of the strategy for health, but then how do you finance against that strategy? So one example I like to give is if you think about mental health conditions, mental health is about 2% of the total health budget on average around the world, but makes up 15% of the total disease burden, which means that there's a significant access gap to evidence-based treatment. And even the funds that are spent aren't necessarily spent on the most evidence-based things. And so there's really an important task to understanding what are you trying to solve in the health realm, be able to allocate resources effectively, knowing which interventions are actually most effective, and also potentially using things like artificial intelligence or other analytic approaches to be able to dynamically allocate funding, of course, with all of the necessary safeguards and algorithmic things, but to figure out, all right, how can we actually get the most health for each dollar that we're investing? And so I think that cross-sector collaboration here is also crucial because if it only sits within the health sector, yes, we may be able to improve health better, but it will be more difficult to really scale the investment we need because the other sectors aren't brought in.
Yeah, and I want to talk a little bit about that in the public and private collaboration and where you see the opportunities for more of that in this space.
Yeah, so I think the important thing about the public and private collaboration is you should really do it where the incentives are aligned towards better health. So I think one of the examples is in blended finance, which I know was discussed earlier today and is a big topic. When you think about investments in health, not every investment in health would be a good fit for that type of funding. So you would want things that have a reliable revenue return and things like that, versus things like investments in prevention have a much longer timeline and may not be a good fit for those. And so you may have to de-risk more than you otherwise would have. So the devil is really in the details, and you have to think about kind of given the risk return profile in terms of health of what you're investing in, but also is it revenue generating? Is this longer term prevention that is harder to get? Those are really the places where designing it and the nitty gritty of all of this is super important.
So, just around the corner at the World Bank, there's a lot of people here, and meeting and making the case and the pitch for why investing in their issue is important right now. So what would be your kind of final pitch or call to the finance ministers and people working in development finance on why investing in health should be really top of their priority list?
Yeah, so I think the most important thing to me in the pitch for why health is it is so involved in all of the other things that we are investing in. And so in order to really get the full potential of our investments in these other areas and important things like climate infrastructure and other things like that, we really need to also invest in our people alongside, not because it's the right thing to do, not only because it's the right thing to do, but also because it's a smart thing to do to get the best of our investments.
Yeah, well, at the end of the day, this is all about people, right? And I think
Exactly.
healthy people and healthy lives, a healthy planet. So Brad, thank you so much for your time, and thank you to McKinsey Health Institute for being a partner today.
Thank you.
Yeah, thank you.